Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on the physicians and practitioners who are redefining medicine through their integrative, functional, and holistic approach to health and well-being.
Welcome to our weekly podcast, Redefining Medicine. We are pleased to welcome Dr. Terry Wahls, a clinical professor of medicine at the University of Iowa Carver College of Medicine, a clinical researcher, and publisher of over 60 peer-reviewed scientific abstracts, posters, and papers. In addition to being a doctor, Dr. Wahls is also a patient with chronic progressive disease. Dr. Wahls, thank you so much for being with us today.
Oh, thank you so much for having me.
Dr. Wahls, you have suffered with multiple sclerosis and severe pain due to trigeminal neuralgia. Let us begin with you telling your story.
Yeah, I first developed symptoms with my leg 20 years ago. My leg grew weak. I saw the neurologist who said, Terry, this could be bad or really, really bad. And at that time, I thought about the trigeminal neuralgia that I'd already had for 20 years. So yes, I knew it could be bad. I saw the neurologist, saw the best people in the country. I had multiple sclerosis. And within 3 years, I'm in a tilt-recline wheelchair. I take Novantrin infusions, then Tizabri infusions. Nothing helps. The trigeminal neuralgia is relentlessly worse. By 2007, I cannot sit up in a regular chair. And my trigeminal neuralgia is relentlessly more severe. I'm going to the pain clinic, taking injections. I am taking Solumedrol. That is when I integrate what I've learned in basic science, ancestral health, integrative and functional medicine, and I devise a new program focused on creating health for my mitochondria. And to my amazement, and the amazement of my physicians, my strength is restored. My pain is resolved. And 1 year later, I am able to bike 18.5 miles with my family. And of course, that changes how I think about disease and health. It will change the way I practice medicine, and it changes the focus of the clinical research that I do.
Why is there so much resistance to your message?
I think new ideas are very difficult. It's really hard for people to believe that I could have such severe disability, such severe pain that was resolved with a diet and lifestyle interventions that are under people's control. So there's a huge resistance. I did that in my clinical trials, and we published paper after paper after paper showing other people can do what I do, in that we have remarkable success. Change is hard. None of us want to change closely held beliefs.
How many clinical trials have you conducted about diet and multiple sclerosis?
So first we did the case report, then we did a case series, then we did a single arm feasibility and safety study with others with progressive MS using all the interventions that I used. Then we did a small randomized weightless control study. Then we did another small randomized weightless control study comparing the ketogenic diet, Wahls diet, and usual diet. Then we did the parallel arm study that we just published. And so that was our fourth clinical trial. We have another trial that's ongoing that we're doing right now. That's our fifth. And we're about to launch two more, our sixth and our seventh.
Tell us more about your recent study, Swank versus Wahls elimination diet.
So this was a low-fat saturated diet compared to the modified Paleolithic diet, the Wahls diet. We had an observation period of 12 weeks. So we did baseline measurements after the observation period. Then we randomized them, gave them the Swank diet or the Wahls diet, had them come back in 12 weeks, repeated the measures, and then had them come back in another 12 weeks, repeating the measures. So we're able to show that both diets, Swank and Wahls, led to reduced fatigue, improved quality of life after the observation period. Notably, the Wahls diet had a higher level of improvement in the quality of life that was clinically and statistically significant. and a greater reduction in the modified fatigue impact scale. Again, that was clinically and statistically significantly greater than the Swank group. And the Wahls group had greater walking endurance improvement as well.
What are the next studies that you are doing?
So what we plan on doing next is a waitlist control study of an online program that focuses on a multimodal approach for improving mitochondrial health, microenvironment, stress, exercise for these patients. We'll be starting that shortly. Very, very excited about that. And the other study that we're starting this fall, a ketogenic diet versus a Paleolithic diet versus the dietary guidelines. We'll follow people for 2 years. We'll have MRIs at the beginning and MRIs at the end. This will be the largest and longest dietary intervention study that's been done to date.
You will be speaking at the upcoming World Congress live in December, and you will be presenting on the 4 M's. Can you share with us what the 4 M's are?
Yeah, so this is really about how we improve the resilience for our brain. So we're going to be focusing on mitochondria and understanding the cell danger response. Then we'll move on to the microglia that we understand are so vital in either repairing and nurturing the brain or making a more toxic environment for the brain. And then what are the things that help the microglia be more nurturing? And that is the microenvironment, of which one of the things that are most important are the level of micronutrients that are provided to the brain, to the mitochondria, into those microglia. That'll help people really shift the possibility of a neurodegenerative disease being diminished in letting the microglia create a more neuroprotective environment and a more healing environment.
Thank you. Dr. Wahls, what advice would you have for someone who has been recently diagnosed with multiple sclerosis?
So I'm going to also add long hauler syndrome, because they're really very similar. You have lots of neuroinflammation, lots of fatigue, brain fog, and immense amount of fear. So step number 1, please go get my book so you can be optimistic and hopeful that there's so much under your control. So address your diet, address meditation, sleep, gentle exercise, and then work with your physicians. Drugs may be appropriate, but they won't be sufficient. So yes, you may need to have disease-modifying drugs, but more and more neurologists are agreeing with me finally that it's critical to have a healthy diet. It's critical to have meditation, good sleep, and gentle exercise. And the research will tell you the best response right now is to the modified paleo diet that we teach in our books.
Thank you so much, Dr. Wahls, for sharing your story, your research, and your expertise with our listeners. We're truly grateful to have you on our podcast.
Thank you so much.
And thank you to all of our listeners for joining us. Until next time.